Here we go now.
Hello, I'm Dr. Ross Walker. I'd like to talk to you today about our biggest killer. Our biggest killer is cardiovascular disease. So we're in the middle of this pandemic, and the pandemic everyone thinks is a dreadful thing. Over the past 20 months in Australia alone, we've had around 1,500 deaths from the coronavirus. Over that time, we've had close to 80,000 deaths from cardiovascular disease. So we really need to be focusing on what's the most important issue in our health, and that is our cardiovascular health, pretty closely followed by cancer. So I'd like to start off with a story. In the late 1960s, a 7-year-old boy was playing at home and a family friend had visited. It was a cold Sunday afternoon in Sydney, and this was a very, very cold day. This young boy was playing in the house, and this family friend Fred had excused himself to go to the bathroom. As the boy walked down the corridor, the door to the bathroom opened and Fred dropped dead in front of him. The little boy was taken into his room and told never to think about this again. Fred had gone to heaven, he won't be visiting anymore. Now that's the first story. The second story is about 14 years ago, a 53-year-old cardiologist was playing soccer on a cold Sunday afternoon in Sydney. 20 minutes into the game, the 60-year-old fullback on the other side dropped dead suddenly. Now, because he was a fullback, the cardiologist resuscitated him. Had he been a forward, he would have let him die, of course, because they're such prima donnas. And the cardiologist kept him alive for 15 minutes. The ambulance arrived, he was hit with the packer-whacker, went back into a good rhythm, got to Royal North Shore Hospital, and within 2 hours had his chest split open and had coronary bypass grafting. Now, the reason I'm telling you these two stories is that the 7-year-old boy and the 53-year-old cardiologist was the same person, and that was me. And back in the days when I was a young child, back in the 60s, there was no treatment if someone died suddenly. But these days, in the last couple of decades, we've had wonderful treatments for heart disease. But here's the problem. The problem is the best treatment of heart disease, the best treatment of cancer, the best treatment of all modern diseases is not to get them in the first place. And what I'm talking about here is prevention. But here's the problem with the medical system. We spend 88% of our health dollar on people who are already sick. And the reality is that the best treatment, 50%, comes from our lifestyle behaviours. 20% comes from the environment. 20% of disease is your genetics. And only 10% of people have access to really high quality healthcare. So the system isn't working and the system needs to be improved. And here's one of the problems with modern medicine. One of the big problems is that we have the ambulance parked at the bottom of the cliff waiting for people to fall off. So instead of fixing the rails at the top of the cliff, i.e. prevention, what do we do in medicine? We build faster ambulances. It just doesn't make sense. It's a bit like people in the financial world waiting for people to go bankrupt, then they give them financial advice. So we need to really start focusing on prevention. And the problem is with the coronavirus, we put so much attention on treating the virus. And I'm not saying we shouldn't, and I'm saying the death of anyone from anything is a tragedy. But what I'm saying is we really should be getting our focus into where it really counts. Now, one of the other big problems in our modern world is there's too many people. So we have to divide our health dollar based on the population we're being exposed to. And one of the other big problems is, of course, air pollution, because there are too many people. And you'll be surprised to know that air pollution accounts for 1 in 8 deaths now around the globe. 1 in 8 deaths due to what we're doing to the environment. This is just a shameless plug for my latest book, The 5 Stages of Health, where I talk about all of these things in the book. But then let's focus now on cardiovascular disease. It kills at least 17 million around the globe every year. 31% of the deaths worldwide are due to cardiovascular disease. There is no one listening to this today, no one watching what I'm saying right now who has normal arteries. Everybody over the age of 20 has some degree of fat in the wall of their arteries. So if you look at this picture here, that round thing that looks a bit like a donut is your artery. And over years, the fat builds up in the wall of the artery. So if you imagine a donut, the hole in the middle, but the fat's occurring like this, you don't even know that you've got this condition. So over decades, the fat builds up and builds up and builds up. And one day when you're under stress, it suddenly cracks open. So you see the little crack there in the yellow bit, that's the cracking open. Then a big red clot forms over the top. And this is what your artery looks like. So within 10 minutes, you can go from no block to a severe block like that. Now, I want to tell you a couple of stories. This man here is Professor Roy Walford. Professor Roy Walford wrote the book, The 120-Year Diet. And he said if you follow his diet, you'll live for 120 years. Now, his diet consists of 1,500 calories a day of plant food. And he has a small group of followers around the world, not many, of course, who look like this. These people don't have an ounce of body fat. They're constantly cold, tired, miserable, and often depressed. But they believe if they follow Professor Walford's diet, they will live to their 120. And let me also say there's no alcohol, no coffee, no meat, no fun in this diet. So I'd like to tragically report that about 10 years ago, Professor Walford died at the ripe old age of 79, despite writing the book, The 120-Year Diet. He lived 1 year less than most people live in this society on average. And so no one wants to live that sort of miserable existence. This woman here is Jean-Louise Calment. Jean-Louise Calment is the longest living person ever who had a birth certificate. She died at the age of 122 in Paris. At the age of 121, she recorded a rap dancing song. At the age of 120, and this fact is like putting a knife in a cardiologist's chest and twisting it. At the age of 120, she gave up smoking because she said it was becoming too much of a habit. Now again, not all of us are going to live to our 122, and certainly we don't want to die in our late 70s. You can live longer than that if you follow what we're talking about today. But here's the problem. It's your genes that loads the gun and your environment that pulls the trigger. So all heart disease is genetic. But I've never seen one person in 40 years of practicing medicine who had a heart attack, a stent, a bypass, or a stroke who wasn't under some degree of stress at the time. But they still had lousy genetics in the first place. Now we look at the 5 primary risk factors for heart disease. What are they? High cholesterol, high blood pressure, cigarette smoking, diabetes. Diabetes is the combination of diabetes and obesity, and of course a family history. So, and what does that mean? Not you've got a grandfather who in his 80s had a heart attack. I'm talking about one of your first degree relatives had heart disease before the age of 65. But the reality is the 2 genetic common causes of heart disease are a thing called insulin resistance and another thing called lipoprotein(a). Now, you've probably never heard of lipoprotein(a) before, but 1 in 5 of you have this. So let's focus first on insulin resistance. Insulin resistance is the commonest genetic abnormality in the world. 30% of Caucasians, 50% of Asians, and close to 100% of people with darker skin or olive skin are insulin resistant. And how do you know you're insulin resistant? Firstly, after an overnight fast, your blood sugar level is elevated, or what we call hemoglobin A1C, which is the 3-month control of your sugar, is elevated. Now, if your doctor says, oh, I think you might be insulin resistant or pre-diabetic, let's do a glucose tolerance test, don't do it. It's 2 hours of your life you'll never get back. Also, part of insulin resistance is high blood pressure, and that's a blood pressure that's consistently above 135/85. Also, your cholesterol is abnormal, but not a high total cholesterol, that might be high, but you look at high triglycerides, low HDL, highly consistent with insulin resistance. One of the big features of insulin resistance is fat around the belly. That's the big problem. So for men, the waist circumference should be less than 95 centimetres. For women, it should be less than 80 centimetres. I'm sorry, ladies, I don't make the rules, but it's 80 centimetres. And then finally, all of these things lead to cardiac disease, to fatty liver, to gout, and even many of the common cancers as well. Now, this woman here has a very big backside. It mightn't look good, but it doesn't hurt. What hurts is fat around the belly. And you see here, impolite as they were, the other bears could never help but stare at Larry's enormous deer gut. And that's the problem. It's fat around the belly. And we see here what we call the metabolic syndrome. The metabolic syndrome is insulin resistance becoming a clinical syndrome. And you see the progression of insulin resistance to the last fellow sitting in his chair, consuming excessive takeaway food and not doing a lot of exercise. Now, lipoprotein a, this is a lipoprotein a molecule. I don't expect you to get too focused on this, but 1 in 5 of you listening to this tonight or today have a high lipoprotein a in your bloodstream. And the only way of getting it is to pick the wrong relatives. It is purely genetic. Now, I'd like to tell you a story about this man. This man's one of my very dear friends, a man by the name of Peter Switzer, who's one of Australia's top TV and radio economists. Now, Peter doesn't mind me telling the story because he wrote about this on his website. But Peter, very, very healthy man, lives a very good lifestyle, but his father died at 53. And I said to Peter, look, it's about time you come in and have a coronary calcium score. And I'll explain to you a bit about that in a second. So Peter had the coronary calcium score. It was extremely high. I put him on my treadmill, did a stress echocardiogram, took a picture of his heart before and after exercise. He had quite severe changes on the stress echo, put him straight into hospital. No symptoms at all, by the way. He had severe triple vessel disease and had bypass surgery. Why did Peter have coronary disease? Because he had an elevated lipoprotein a. Now, most doctors aren't even measuring this routinely, which I do in all of my patients and have done so for the last 25 years. And this study here clearly shows the higher your lipoprotein a, the higher your risk. So in terms of reversing heart disease or preventing it in the first place, there are 5 key components. Number 1 is to take the test. Have the assessment, which I'll talk about in a second. Number 2, lifestyle is king. So don't come in here with a big fat belly or a cigarette hanging out of your mouth and thinking that being on something to lower your cholesterol is going to be your salvation. It's looking after yourself, which is much more important. I'll get to that in a second. But I'm not against orthodox medicine. The appropriate use of therapy for people who are at high risk is absolutely indicated and should be done. So if you have a lot of muck in your arteries, if you've had a heart attack or a stent or a bypass, you should be on statin drugs to lower your cholesterol. But if your cholesterol is through the roof, but your calcium score is 0, you certainly don't need a statin. Then the next bit, and I'm an integrative cardiologist, so I believe in the appropriate use of good quality medicine, but also the appropriate use of evidence-based supplements. That's also very good for you. And also the final component here is to have regular follow-up with a trusted doctor. So about 22 years ago, this extremely handsome young man here introduced this technique into Australia called coronary calcium scoring. And what you do with a coronary calcium score is you take a snapshot of the arteries. So you can see on the study on the left-hand side is normal arteries with no calcium, but on the right-hand side, very dense calcium. And I feel that all males at 50, all females at 60 should have a coronary calcium score to assess how much muck you have in the wall of your arteries. So the people who need coronary calcium scoring, firstly, if you've already had heart disease, there's no point having a calcium score because you're already there. This is a diagnostic test for heart disease. Males at 50, females at 60, as I've already said. But earlier, if, for example, your father had bypass at 45, you should have a coronary calcium score when you're 40. Or if your cholesterol is extremely high and your doctor wants to start you on a statin in your 40s, have the coronary calcium score first to see whether you actually need it. It should be done every 5 years if you've got very low scores. Once the scores get very high, you don't need to have it repeated. But probably the most important message I will give you today is about the 5 keys of being healthy. And this is the most important thing I say to all my patients and say all the time on my radio shows and in my books. So what are the 5 keys of being healthy, from the least important up to the most important? Number 1, quit all addictions. Number 2, good quality sleep. Number 3, nutrition, which is basically eat less food, eat more natural food. Number 4 is exercise. And the most important drug on the planet is a thing called happiness. This is the real reason dinosaurs became extinct: smoking. If anyone's out there who's a smoker, stop today. That's the best advice I can give you. And this shows you, even no matter what age you stop, you will still get a benefit from stopping smoking. So please give up those cigarettes. You should never see alcohol like this. And also this says, "Tell me, Mary, do you use drugs?" And Mary says, "No, Mother." Why? So because you're chopping your onion with your bank card. Anyone who uses illegal drugs is sick and should not be doing so. Very, very bad for your health. Number 2 is good quality sleep. Insomnia is very common. Try not to lose any sleep over it. 30% of the population suffered at some degree of insomnia, and also many people suffer sleep apnea. So having 7 to 8 hours of good quality sleep per night is as good for your body as not smoking. Number 3 is nutrition. And nutrition, as I said before, eat less, eat more natural food. But all of us should be having 2 or 3 pieces of fruit per day, 3 to 5 servings of vegetables per day. Serving's about a half a carrot. You go, "Well, that's easy, Doc." If it's easy, how come less than 10% of people have that amount of fruit and vegetables every day? And those who do have the lowest rates of heart disease and cancer in the community. So have those fruits and vegetables. If you want to, on top of that, little bits of meat, eggs, dairy, chicken, fish, nuts and olive oil, and avoid what I call white death: sugar, white bread, pasta, potatoes, to a lesser extent rice. I'm not saying don't eat them, but I'm saying minimize your intake of those things. When I read about the evils of drinking, I gave up reading. I actually enjoy a glass of wine each night for its health benefits. The other glasses are for my witty comebacks and flawless dance moves. So look, the evidence shows 1 or 2 glasses of wine most days of the week has a weak health benefit. But if you don't drink, I wouldn't encourage you to drink. But if you enjoy some alcohol, make sure you keep it down to levels that actually have some health benefit. Because once you get above 2 standard drinks on a regular basis, then you're damaging your health. Second best drug on the planet, exercise. But exercise shouldn't just be running or walking. It should be 2/3 cardio and 1/3 resistance training, as you see here. And you want to do exercise also to maintain stability, agility, and flexibility. The doctor asked me to spend at least 1 hour a day on the treadmill. Probably not like this. Now, again, what are the benefits of exercise? If you have a 3 to 5 hour a week exercise habit with 2/3 cardio, 1/3 resistance training, you're reducing your risk for heart disease, cancer, Alzheimer's, diabetes, depression by about 30%, osteoporosis 50%, you drop your blood pressure and you sleep better. There is no pharmaceutical preparation known to man that comes anywhere near exercise. And one of the main cause for loss of independence in the elderly is not decline in brain function, but it's loss of strength, endurance and mobility from lack of exercise. So as I said, it's the second best drug on the planet. But the best drug is happiness. Everyone who passes through this door brings happiness. Some by entering, some by leaving, as you well know from all the people you hang around with. So peace and happiness, in my view, are the best drugs on the planet. And I'm not suggesting that happy people don't get sick. What I am saying is happy people don't get as sick as unhappy people. And when they do get sick, they get better quicker. And this study here, which I want you to all write down, this is called the Morgan trial, and this basically shows, evidence-based, that if you practice those 5 keys of being healthy, you reduce your risk for cardiovascular disease by 83%. If you take a drug to lower your cholesterol, you reduce your risk for cardiovascular disease by about 20 to 30%. So any sort of lifestyle program is 4 times more powerful than anything you do as far as a doctor or taking a supplement. So please get onto that stuff. So of the treatment of heart disease and the prevention, 80% is lifestyle, 20% is medical therapy, which includes supplements. So again, if you have a high chlorine calcium score above 100, or if you have already had a heart attack, stent or a bypass, of course, statins should be part of that. But lifestyle modification is more important than the statins. So this is a skewed picture. And this is a study to show that if your coronary calcium score is below 100, you are not going to get a benefit from being on a statin. So I don't care if your cholesterol's 9, if your calcium score is 0 or 30 or something like that, there's no benefit. Once it gets above 100, that's when you see the benefits of being on a statin. And also, look, if you're getting chest discomfort, you're walking up a hill, you're getting chest pain, or you're sitting home one Friday night and you start getting this crushing central chest pain, don't say, oh no, I'll go and take my supplement, or I'll go for a walk tomorrow, or I'll ring my doctor tomorrow. You ring an ambulance, you get to a hospital, you get a stent in your arteries. That's the best treatment when you're having a problem. Never ignore symptoms. Symptoms are nature's ticket into the system. And I'm a great believer in evidence-based supplementation, and we can talk about that on another occasion, but also having regular follow-up with a trusted physician is vitally important. So what I'm saying to you is that if you practice these 5 keys, you're reducing your risk for all diseases by so much. And the 5 keys are, just to summarize them: number 1, take the test. Find out where you are right now. Number 2, practice lifestyle modification. That's 80% of your management. Number 3, the appropriate use of orthodox medicine, which is 10% of your management. The appropriate use of supplements, which are, why are they called supplements? Because they're supplements to a healthy lifestyle and anything else you're taking. Number 4, go for regular follow-up. And number 4 is the supplements, and number 5 is to go for regular follow-up. Please follow all these things, because heart disease is our number 1 killer, but with the correct approach, it can be controlled and in many cases reversed. Thank you for listening.